Hi all, this is Balaji Nujella, your physiotherapist. In the previous programs, we have discussed about how many days do you require physiotherapy or something like that. No, the duration of physiotherapy is totally dependent on two major outcomes: your range of motion and your power. The two main things, or the third subjective thing, is pain-free or pain-free range of motion. So three main things which you need to concentrate are pain-free movements, full range of motion of straightening the knee and bending the knee up to 90 or 120 degrees as prescribed by your orthopedician. Now, bending the knee is one important thing what I would like to discuss. Most of the times, people will say that prior to surgery, I used to bend my knee joints. Even with bad knee, I used to totally sit on the ground and could get up. But now I'm not able to. It is not like that, sir or madam. Thing is, you can do that. There are many types of knee replacement or the prosthetic joints available by many companies. There are cruciate sparing or posterior stability prosthetics or high flex knee prosthetics, whatever, all those things. That prosthetic knee, what they are using, there can be a high flex knee also, which improves or which allows more range of bending. But why the orthopedician or why your doctor limits your bending is they'll put a limit for bending. Why? Because it is not that you should not bend or you can't bend. People can say that I have put so and so lakhs of amount of money, I've got the best implant done, why should not I sit down and cross my legs or bend my knee? You can happily do that. Depending on your orthopedician's advice and your ability, you can happily do that. But overbending will cause the prosthetic joint to loosen early or to undergo degenerative or damage more early than expected. Usually the expected lifespan of a prosthetic joint is, say, 15 to 20 years, depending on the type of joint what they use or type of the material what they use. So if you do all these unnecessary bending activities and all more than the prescribed range, you can land up with a revision arthroplasty or redoing the arthroplasty much more early. Maybe in the first 10 years only you might go for a revision arthroplasty. Again, they need to bore down a long stem into your shin bone and they need to place another joint, new joint. So to avoid all this confusion and unnecessary issues, your orthopedician or physio might advise you not to bend the knee too much. Yes, whether you take a high flex knee also, whether you get a high flex knee done also, don't, because there is availability, don't bend too much. Thing is, we usually will be limiting. In our setup, I'll be limiting for 100 to 110 or max 120 degrees of flexion, not more than that for sure, just to avoid unnecessary or undue stress on the prosthetic joint. All of you, my request or my thing is, what I would like to say is, remember one thing: a bad natural joint is much better than the best prosthetic joint. Means the joint what you are having, even if it's in a grade 3 or a bad shape, better try to preserve it. If you are forced to go for surgery, go for it. Even though you have the best implant, do not try to do extreme range of movements just to improve the lifespan of your new joint. So these things the things which you should avoid post surgery is, first and the foremost, avoid sitting down with crossed legs directly on the floor. Avoid too much of bending at the knee joint, and do follow all the exercises or do practice all the exercises what your physio says or what your orthopedician advises, especially those exercises which help your knee to straighten. Strengthen the thigh muscles, both front and back thigh muscles, and do regular walking and all these things you can do. The only things you're asked not to do is, do not sit down and do not bend the knee than the prescribed angle which is prescribed by your orthopedician or physiotherapist. That's it. doing proper exercise will help in maintaining your even new joint and the periprosthetic bone of the joint more healthy. Thank you.